It sounds crazy, but what if I told you there's a foot surgeon who loves to do foot surgery, but has figured out a way to keep you from the operating room? Dr. Mitch will share with you his four-step protocol. All you have to do is stay tuned to the end of this video.
Greetings, everybody from near and far. So one afternoon, I was at the surgery center doing a case, and one of the anesthesiologists came up to me and said, "Hey, Mitch, we haven't seen you for a while. Have you been taking your cases now to Mercy Hospital?" And I said, "No, I've been right here. I've been doing a lot of operative procedures that, I haven't had to do as many major foot surgeries as I used to because I'm doing this new therapy that's getting people well." And he laughed and said, "That's interesting. But a surgeon doing a procedure, non-surgical, but avoiding what he makes his living at." And I said, I went back to my office because I was thinking about that, like my shooting myself in the foot by doing this protocol I've developed. And I have a four-step protocol that will eliminate foot surgeries fairly frequently. And I'll tell you about that in a little bit. But I went back to my office and did a little analytics with my statistics, and I found that, in the years previous, I used to see about 80 new patients a month, and I did 8 to 10 surgeries a week. I saw 35 to 40 patients a day, and I know what my overhead was, and I know what my gross income was. So I had a pretty good handle on the health of my practice. And I noticed that this last few months, since I've been doing the Bowen Therapy, that my new patients went up to about 100 new patients a month. And my office visits went to 45 or 50 a day, but I was only doing about 5 or 6 foot surgeries. I said, "Whoa, this system is working." And then I looked at the numbers financially, and I was doing just fine. Actually, I was doing better financially, not doing surgery than I was before when I was doing surgery. And I had less stress. I slept better at night because I wasn't worried about patients having complications and bad results and things like that that goes with such surgical territory. And so I was at peace. I did some more mathematics, and I see for 20 years, that's about 48 weeks per year. For 20 years, I did some unnecessary foot surgeries, probably. And I subtracted, on average, I was doing about 3.5 surgeries a week less doing my protocol than where I was before. And so I multiplied it out, and I said it was about over 3,000 foot surgeries I probably performed in a 20-year stretch that I didn't need to do. I'm making amends to all those people right now. And I'm sorry I didn't know any better, but in the system, they don't teach us except what they want to teach us. They show the doctors what they want us to do. Based on the standard of care and the technological advances, pharmaceuticals and our surgical instrumentation, implants and screws and wires and a paraphernalia that go along with surgery that they're promoting the use of. They teach us how to use it. And so that they didn't teach us how to do non-surgical procedures. I learned those on my own and through my behavioral analysis. I'm a people watcher, and I do barnyard logic. That's called common sense. And then I connect the dots, and I looked at one thing, it leads into another, it leads to another, and I can get a sense of the big picture, and I figure things out. So I figured out how to help my patients avoid foot surgery and cortisone shots and excessive medical treatments over the years. And it is effective. And there's only 4 things that we have to do in order for you to have a good chance of avoiding foot surgery. And I'll tell you about bunions in another episode of my saga. when I get to the bunion part, but this is just a general about foot surgery. And I used to have an aversion to the patients that they get a new patient with a bag, shopping bag, come sitting on the floor when I would introduce myself to them in my consultation office. And I'd say, "How do you do?" And I say, "Oh, you've got some things here for me to look at." And they say, "Yeah, I've got," so they've had orthotics and insoles and arch supports and shoes and medical records. And they've had cortisone shots and they've had physical therapy and they've had surgical procedures. And their foot still hurts or their feet still hurt. And I used to say, "Well, what do you want me to do about it? You got to have everything done that I could do, but I'll try something." So I always got a little something ace in the hole. But now with my 4-step protocol, I would say, yeah, you came to the right price. Probably about a week or so, you'll feel better. And maybe 2 weeks, you're going to be almost better. And maybe 3 or 4 weeks, you'll have to be out the door a happy camper. And what we're going to do is, well, number one, I'm going to tape your foot with adhesive tape to hold that arch up and keep the foot from moving abnormally, which is going to prevent your legs from moving abnormally, which is going to improve your posture. And then I'm going to balance your muscles from your head to toe to get everything all aligned and loosened and in better alignment. And then if you do some little home exercises to strengthen some weak muscles and soften some tight muscles and soften some soft tissue that are tightened, and wear little spacers with when you're wearing your pantyhose, you put a little spacer between your toes. And you do a few simple things like that. So that's 1, 2, 3. And then 4 would get custom orthotics at the end of the 3 or 4 weeks when you're all well and you're feeling good and your posture is all balanced to maintain you. And you got a very good chance you won't need any surgery. You'll have a very good chance you won't need any cortisone shots. You won't need any physical therapy. You won't need any extended care. All you got to do those 4 things and you'll be set. And I could tell that to people with a straight face, and I was totally honest that I could do that. And that became one of my favorite things to do. I would love the patients with a shopping bag full of orthotics and things like that. Yeah, I can fix it. Just hang, sit down, shut up and buckle up and go for the ride. And after about, I proclaimed to myself, I didn't tell anybody that I was the foot pain specialist. I wasn't just a specialist who treated foot pain. I was the foot pain specialist. That was the source. And after a while, I started seeing patients on the schedule who were scheduling for foot pain. And they never used to. They used to say, they'd always schedule for bunions or hammer toes or plantar fasciitis or heel spurs or warts or corns or callus. But never would they schedule for foot pain. But after I made that proclamation, people started to, and that's in another segment that I do on manifestation. I can tell you how to manifest your dreams and make your dreams come true if you want to. So we'll save that for later. But suffice it to say, you have 4 steps to do for conservative treatment that you can eliminate your bunion pain or your foot pain. And man, you can join the Happy Camper Club. So that's all I've got for today, and I'll see you next time. Please hit the subscribe button and the thumbs up if you like this presentation, and you can share it with a friend, and we can maybe around the world, we can diminish the need for surgery and medical misadventures. Thanks for watching.